Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking with board-certified dermatologist Dr. John Pelachyk in this segment about melanoma. Dr. Pelachyk, what parts of the skin does melanoma affect?
Well, melanoma it arises from part of the skin where the pigment cells or melanocytes are located. As we talked about in the earlier segment, the top layer of skin, called the epidermis, in the basal layer or the bottom layer, interspersed among the basal cells, are pigment cells called melanocytes. And these types of cells are the cells that melanoma develops from. These types of cells are also the same cells that we see in moles or nevi, and oftentimes the cells in moles and nevi, they can either be located at the border, the lower layer of the top layer, epidermis, or they can be located in the second layer of the dermis. It's the same type of cell, but they can be located here or here, and that's the cell from which melanoma evolves.
Can you get melanoma at any age?
Yes, you can. Melanoma can occur at any age from childhood and adolescence on up. It's more common in adults because we believe that sun exposure, ultraviolet light exposure, certainly is a important factor in development of melanoma, but it can develop in areas that are not exposed to light as well. In fact, melanocytes, besides being in the skin, are found in the covering of the brain, in the retina of the eye, in mucous membrane areas like the lip and rectal areas. So melanoma can occur at any age.
Wow. What are the symptoms then?
Well, when it comes to the skin, we like to review a type of mnemonic called ABCDE. And those are the symptoms we look for in looking at moles or pigmented skin lesions that we think are melanoma. A stands for asymmetry, and what asymmetry means is that when you draw a line through the spot or the lesion, each half in a normal lesion should look exactly the same. And you can see here that if you do draw a line here, that is not the case. You have a dark color here, you have a lighter color here. Instead of being nice and outlined, you have notches and so forth. So this is an asymmetric lesion. B stands for border. In most moles, the border, and this is a mole that melanoma developed in, but most moles, the border is nice and smooth. It's either oval or round shaped. Here you can see that there's notches in here and blurred edges, so this border is not regular. C is color. Most benign moles, the color of the mole is the same throughout. It could be light brown, medium brown, or even dark brown, but it's all the same color. In melanoma, we see variation in color. Again, clearly here there's a dark, very dark black area, a grayish area, a brown area. Sometimes we see a red area. And the color variation is another indication that it could be a melanoma. The fourth thing we look for is diameter, or the size of the mole, or the pigmented lesion. Most moles are about the size of normal moles, benign moles are about the size of a pencil eraser, somewhere in the range of 6 to 10 millimeters. But melanomas, because they're growing lesions, are oftentimes larger than that. In this case, it's stated that this is 1.2 centimeters, which is about double the normal size of a mole. So the diameter of the lesion is another important factor. And the final factor we look for is evolving. The E stands for evolving or evolution. So in this case, we had a benign mole here that probably for the most part looked like this throughout, but then over time, this new black bump developed within the spot. So this mole went from looking like a regular benign type mole to something that evolved into something different with the development of this dark nodule. So that's another characteristic we look for. Now, if you have these characteristics in a mole, it doesn't mean for sure that it's melanoma, but it's something that alerts us to the fact that it might be something we need to look at more closely or biopsy.
Can melanoma spread?
Yes, absolutely. Melanoma can spread from the skin through really any parts of the body. It can go to the brain, to the lungs, to the lymph nodes, and the propensity to spread is unpredictable. We can't really predict with certainty which melanomas will spread or when they will spread, if they spread. But absolutely it can spread, and so that's why it's a very serious lesion.
So it's important to diagnose it early.
Absolutely, absolutely.
And how do you diagnose it?
Well, as with previously, we skin exam, both by the patient themselves, looking for the changes we talked about, and by the physician who looks at pigmented lesions and uses these characteristics to help determine if it looks atypical or not. And if there's any question, we will do a biopsy to look under the microscope to determine if the cells are atypical or not.
And how do you treat melanoma?
Well, melanoma is treated, the primary treatment of melanoma is removal, complete removal, excision. So early diagnosis is so important in this disease, because if the lesion is small, the characteristics that we look for are the size of the lesion, the thickness of how deep it's penetrated into the skin, if it has ulceration on top of it, if the cells are atypical, how fast they're dividing. These are all characteristics of melanoma. And some of these we can see clinically, and some we do under the microscope. So when you have a melanoma, you want to catch it in the earliest phase, when it's very thin, when it's not ulcerated. And if you completely remove it, excise it, that essentially is curative at that point. If it's spread, then there are other methods to treat it. There are chemotherapy agents we can use. There are some newer agents now, biologic treatments, and treatments that are aimed at certain substances that cells secrete. In the past 2 or 3 years, in fact, there's been a development of several new drugs which have prolonged the life of patients who have metastatic melanoma. These are now available for use. There still is no cure if it's spread. In most cases, it's just better control. So obviously, the sooner we can take the lesion out, the smaller it is, the better it is.
So you've talked in treatment about all the way from curing it to it has metastasized. So is this a cancer that needs to be watched over time?
Absolutely. And in fact, when we're talking, when we do, in many cases when the lesion is removed, the surgeon will take and put a dye in the area where it's removed from, and that will travel to the nearest lymph node area of the body. And then that lymph node, the first node that it hits, is taken out and looked to see if there's spread of the cancer in there. It's called a sentinel lymph node. This is something that many patients will have, especially if they're sent to a cancer center like University of Michigan or other areas, or McLaren and Flint. There are areas that other centers that do this regularly. So that's one way we determine if it's spread or not. But once it's spread, then it's much more difficult.
And is it the same, if you're able to get it all, is it the same for these patients as for other skin cancers? You still have to be more vigilant?
Absolutely. Follow-up is very important. With patients with melanoma, we generally follow them every 6 to 12 months, depending on the thickness of the melanoma, how serious it was. That determines the length of follow-up. It's usually certainly no less than once a year, and in many cases, if it's a deeper melanoma, or certainly if it had spread to the lymph nodes or elsewhere, then it may be more frequent than that, every 6 months.
Very good information. Do you have any closing comments for our viewers?
Well, I just want to let our viewers know that vigilance is important. You should examine your skin, and if you have a spouse or significant other, someone living in the home, take a look at your back and the back of your legs and so forth on a monthly basis to look for some of the changes that we've talked about. And prevention is also very important. I would again strongly recommend regular use of sunscreen and avoidance of tanning booths because this is certainly not something you want to do.
Thank you so much for joining us.
Well, you're very welcome, Barb. Glad to be here.
Stay with us, and when we come back, we're going to talk all about that very important prevention. But first, this message.